Welcome to Pat and Behavioral Bytes Coffee Break. I am Scott Simo, and today I am joined by a friend and colleague, Deanna Moyer, a licensed social worker. Deanna has been supporting school districts by designing and implementing MTSS school-based behavioral health programming. She also works on various projects with the McDowell Institute, Bloomsburg University, including suicide prevention, which includes youth mental health first aid and QPR, as well as with PDE and Patton on the career readiness skills standards in trauma-informed care practices with pre-service educators. She has additionally been a collaborative partner with Patton's LEEI, the Learning Environment and Engagement Behavioral Initiative. And in this bite, we will talk about school-based mental health providers and educators partnering to support students with mental health needs in the school environment. As educators, we often think about proactively intervening with students with mental health needs and providing evidence-based trauma-informed care and mental health interventions. Yet, we often don't think enough about partnering with our local school-based mental health providers in helping us meet the legislative requirements pertaining to trauma-informed care, school safety, and suicide prevention plans. Well, in addition, also in thinking about school and district level MTSS and expanding supports in those areas to our students and our families that we serve. So as we get started, let's first talk about some of the crucial and necessary considerations when creating or formalizing partnerships with mental health providers. Deanna, as a social worker and a mental health and educational consultant who has supported school districts over the last 17 years across the state of PA and PDE and Patton, what are your recommendations on formalizing school-based partnerships with mental health providers?
That is a great question. From my experience, it's extremely important to use a framework that has stages such as PBIS, MTSS. There's also implementation science through the National Institute for Research Network. And a lot of people are looking at the SHAPE system, which has come out of the University of Maryland. And we all know the Interconnected Systems Framework. It doesn't really matter what you use because all of these are extremely valuable. But what's similar to all of these are their stages. So before we even begin to formalize our services, we really want to get to a readiness stage. And all of these have a readiness stage, they have implementation stages, and they have other stages that they walk you through. And each of these have very clear documents that take you step by step. But one of the things to consider in a readiness survey is it's a warm-up period when you have an opportunity to build connections and relationships with community agencies. We're doing this all together, so why not start all together? And is the community agency ready? Is the district ready? So let's just use a quick example from the SHAPE system out of the University of Maryland School. And what they have in their readiness is they have an assessment, the school mental health quality assessment. It evaluates strengths and identifies areas of growth. It has documenting mental health services across all tiers, basically resource mapping all the wonderful things that the districts and the schools are doing, engaging their school mental health team in a meaningful, data-driven and strategic quality improvement, which means we, the community agency, would be part of the data and part of the strategic planning and quality improvement. And then they have, like all of the systems that we're talking about, they have a really rich resource center and quality guides that gives you step-by-step improvement efforts, and let's really raise the bar as we go through this. What's not in here are some things to think about before you really formalize a partnership that I have found important because I've made all these mistakes. So I think it would be great, and these are just suggestions, doesn't have to be this way. I think it would be great if administrators start discussing the possibility of bringing in mental health services at faculty meetings. And provide discussion time to outline the benefits. What are the challenges? What are the services going to look like? And any agency should be able, before you even formalize something, different agencies can provide services and ideas of what they offer, or a brief outline. And having the faculty list all of their strengths and what is currently being done, this is critical, because I think before we go in, we have to honor the work that's being done, because there is a lot of really good work being done. We're there to fit into the gaps as the district sees fit. So certainly, and at the faculty meetings, they could be reviewing data points that also might help identify the needs of each school and district. And each school might have different needs. Just because they're in the same district, they might have some overarching needs, but they might have very specific needs based on their school. And there should be a warm-up period to begin connecting the mental health staff. I think this is extremely subjective, because each district and each school within the district, they have different personalities. They have different protocols. Even though the strategic plan is the same for the district, each school district has maybe some tweaking that they do to get to the overall strategic goals. So I think it's important for us to understand the different personalities and the maybe tweaked protocols, so that we're following what they're doing. And then find the person who's passionate about mental health trauma and who's really trusted by the staff. Have them introduce you to begin making those connections. I think that's really critical, because if you are working side by side and in tandem with somebody who they really trust, they're more likely to trust you. One thing that we didn't do, that if I ever had to go back and do this again, would be focus groups. It's a great way to begin this process. So you've decided, okay, we're going to use the community agency A, and let's do some focus groups. And we're going to take the mental health staff and we're going to pair them up with a teacher, an administrator, a school psychologist, a guidance counselor, and we're going to come up with questions and survey the teachers. Because the data may say one thing, but teachers really know what's going on in their classroom, and they really know what needs they have, which might be a little different from what the data is saying. It's also a great way for ownership, where we can hear what they're doing and what they need. And I think it's very easy to go look at data and come in and go, oh, we have these recommendations. We could do this, this, and this. But I think that would be a horrible approach, because it's not about what we think they need. It's about what they think they need. So getting to approach, that's the critical piece. Just like trauma awareness and trauma sensitivity, it is all about approach. And when it comes to working with a new school, I would recommend you approach with a lot of humility, vulnerability, learn from the school and the different FERPA guidelines, because we're under HIPAA, they're under FERPA, and just be vulnerable and say, listen, I don't really know. Can you educate me on this? And go quietly, use your listening skills, and that honestly, you're there to make their job easier. You are not there to replace anyone. And I promise you, there are individuals in the school that get worried, oh, if they come in and do this, I'm doing this. So are they going to replace me? Am I going to lose my job? And we are definitely considered an outsider. So we really need to begin building trust. And once school staff trust you, and they will, because they're going to start seeing positive gains that you're making, they're more likely then to bring you in on other school needs and say, hey, listen, I'm really overwhelmed in this area. Can you help? And that's the gap that you're going to fit into. School counselors and administrators, I know from my experience, were my lifeline. I was always checking in with them, building relationships with them. Every morning I was in there, just a quick check-in. What do I need to know? Is there anything you want me to be doing? Somebody I should check in on? But don't stop there. Certainly connect with non-teaching assistants, your paraprofessionals. Nurses are wonderful. I would connect with the lunch staff, custodial staff, the non-teaching assistants in the hallway, who really kind of have a heartbeat of what's going on in the school. But here's the big takeaway. Make sure that the school staff always has a voice. We are not there to make decisions. We are there to help support them. We're not there to tattletale on them. We're not there to create our agenda. We are there to partner them and meet their needs. So I think that's a huge takeaway. As we formalize these services, here are a couple of other things to think about because we've had these situations happen. Make sure that your mission statements are aligned. We all have mission statements. We know what they are. I don't know that we really think about them very often. I know I don't. But we had an instance where we got into, I was helping a district formalize services with a community agency. And what we realized, they wanted to focus on keeping youth in the least restrictive environment within their district. And the agency had a lot of out-of-district placements. So their mission was really working with the out-of-district placements. So they would say, oh, just refer them to the out-of-district placement. That was their mission, to do really good work in out-of-district placements, but it wasn't the mission of the school. So they had to cancel the contract, and it was a very difficult situation. So make sure that what your goals are the same goals that our mission statement as the community agency has. We talked a little about focus groups. It would be great that if the agency compiled the data with the school to present at faculty meetings, hey, here's what we found. Here's what you said, and your interests and your ideas. And then always leave time for question and answer so we can debrief from that. It would not be the agency presenting the material. It would be the agency with somebody who's trusted at the school district, whoever they identify, doing it together. And then the contract, as we get into the contract, it should be very specific as to what responsibilities, and this to me can almost never be specific enough, which we are going to get into in the next slide. So, a lot of people have contracts. When we started out, our contract had how many clinicians, what their responsibilities would be. We had a budget, and that was about it. And we had the array of what services, what groups we were going to provide, and the type of individual therapy. Nothing else. So as we've learned, we realized it's much better. And in here, there is an example of a memorandum of understanding that walks you through some critical pieces, but doesn't have maybe all the pieces you might want to think about. And here is, so for example, we have goals and objectives. What are our overarching goals? The district wants to expand an array of comprehensive school-based behavioral health services on tier 1, tier 2, and tier 3 by 25%. And then we're going to break the objectives down. We are going to increase the number of students we see for individual therapy by 50%. We are going to space program groups from 3 to 5. So now we're going to look at adding 2 more. We're going to increase office discipline referrals, and these may change over the year. They do change over the years. So we get a really good data-driven areas, whether it's graduation rates or decreasing office discipline referrals through PBIS, and then the work of the community agency on all tiers. But it often changes. And then planning for measuring. How are we going to show the school that we are measuring our outcomes? What pre and post tests are we doing? And a lot of the evidence-based groups have pre and post tests that they recommend and that we use. Also, for the individual therapy, what are the pre and post tests? And what is our rationale and methodology? And it should be discussed. And we want to make sure that our rationale and methodology is okay with the school district. And then a plan for reporting the outcomes. Are we going to report them monthly at faculty meetings? Are we going to report them twice a year, or maybe just at the end of the year? And that's really up to the school district. We're flexible, and we could do it as much or as little as they need. And then also, I think school logistics. This is where we got into some trouble with some schools. We really need a dedicated space due to HIPAA. I know that FERPA trumps HIPAA, which is important to have discussions about. when formalizing, because I know as a community agency, I had no idea what FERPA was, and I had to learn all of that. And like I said, FERPA does trump HIPAA. So we have to know when to communicate, what to communicate, and how to communicate it. So with logistics, we definitely need a space that is confidential. We need to have discussions around 504 plans. We need to have computer access. And what can we have access to? So if we're doing attendance and we're doing office discipline referrals, we have to have access to that. And I know that was a very confidential piece where we really struggled. And what we decided was they were going to open a window for each student that we worked with. So we would only have their data and we had nobody else's data. So there's always a way to solve the barrier, and everybody solves it in a different way. And then let's see. Oh, specialized training. We were all on the SAP team. So if you're going to be on the SAP team, you need to be SAP trained. And we needed to have conversations about who is going to pay for that training. Is it going to be the community agency? Is it the district? Are we going to split it? Or are we going to find a grant? And as well as we started raising the bar using evidence-based modalities on tier 3, especially, what training is needed? What are those specific therapies like EMDR for trauma, which is eye movement desensitization and reprocessing? And there are training costs involved with that. And what happens if staff then leave? You spent this money training them. So there has to be a lot of discussions and logistics that are really outlined in a formalized contract. And there are other cognitive-based therapies, dialectical behavior therapy, that we might want to train individuals in the school districts. And I'll explain later as we move along a little bit more about that.
Oh, thank you, Deanna. Your expertise is much appreciated. Those were great recommendations for formalizing school-based partnerships with mental health providers. And I think oftentimes if districts have this information, they'd be more willing to do so, and they could really see the benefit in the long run. Now, another question that I had for you is, how do these school-based mental health partners fit into a successful MTSS framework at the tier 1 level? For example, if a school was starting to partner with an intermediate unit PBS facilitator and implementing school-wide PBIS at the tier 1 level, oftentimes I would partner with outside mental health agencies. And then, how could additional partnering be done with school-based mental health providers to enhance the school's framework for support at the tier 1 level?
I think that's great, because I think there are a lot of ways you can do this, but we most often get hired to just work on tier 2 and tier 3, and sometimes just tier 3. So here are a couple of thoughts and ideas. You could invite the agency to be part of the tier 1 PBIS or MTSS team. I think that's a great idea. The MH provider should be supporting the matrix. We need to know, what is the matrix? What are the teaching areas? What's the acronym? What are the expected behaviors? And to reinforce the youth exactly as the faculty do. So if we're seeing the expected behaviors, we're handing out the PAW passes or the Pride passes or whatever their system is. If you're in the school before the PBIS matrix has been created, which has happened, and while it's being developed, you can provide input on the acronym and maybe talk about some other social, emotional pieces. Like, for example, in one high school, they had Pride, and I don't remember exactly what they were doing for the E, but we were able to recommend, let's try empathy, because that's a critical component to social emotional learning. And they went with that, which thrilled us. Be present at special events as designated by tier 1. So you have a lot of tier 1 celebrations. We should be present and applauding the school and the youth for meeting those special requirements. And then we could also, with the school district's permission, and only if wanted, surveying all the staff. What are just on a kind of not a real a real kind of laid back way, surveying what are the top needs in your classroom, and then break it down. And let's say 1 month they say self-regulation. So we could, if asked, introduce one self-regulation universal technique that the faculty could use, and we could train them on that technique. If some people feel like they don't need it, they don't have to stay. If some people want it, they can stay. So it's really up to them. We can do as much as they want, and we could do this monthly. We can start with one self-regulation 1 month, and then we could add another piece, disrupting the classroom. And we can just keep adding little teeny interventions that the classroom teachers and educators, paraprofessionals could use. Okay, so this next slide is from Morgan Stanley, Alliance for Children's Mental Health. And this gives you another idea of how we can incorporate the mental agency into Tier 1 practices. So they came up with, there were probably about 15 to 20 data points. We have 4 of them here, and I'm going to review 3 of them. So these were general, broad categories. So the first one is actively, the highest one. So I took the 3 highest ones here, actively supporting students that have emotional difficulties. Professional development, I think, is probably the easiest way for the community agency to provide support for the staff so that they can in turn provide students that are having emotional difficulties or behavioral difficulties. Professional development, we really expanded. Again, I'm always looking to raise the bar. So we started out with maybe a training on depression, or we started out with a cutting because one of the schools had some major concerns about groups of youth that were cutting, and that was the need at the moment. But we started to increase our trainings to include bipolar disorder, ADHD. We were getting trained in question, persuade, refer, suicide prevention gatekeeper training, youth mental health first aid, also suicide prevention gatekeeper training. But another way that we can support specifically, not just the staff, but the students, is teen mental health first aid that has recently come out. So you're actually teaching the teen mental health first aid how to work through, if you know somebody else is struggling, if you are struggling, what to say, what to look for. This is only very specific grades, 9 through 12. Or if you have a freshman, I think the age might be 15. So if they're a freshman, but they're 15 years old, they can also participate. The second one is identifying students with emotional behavior challenges. Best way to do this is universal screening. I know some schools are doing this, some schools are not doing it. It's a huge task, but I love universal screening, and I love the fact that some people would be willing to bring the clinicians on, because I think we can help synthesize and analyze the data. I've seen a lot of the universal screeners that people use, and they have all very specific indicators, and they maybe color code them. So when I'm looking at the screeners, I'm looking at very specific indicators. And when certain indicators are put together, my red flag goes off, and I go, I really think this is more than just behavior. There might be a mental health piece that is underneath, that is the root cause. I would love to consider, if approved by the parent and the school and the staff team, a targeted screener, because we might have rules of what we're going to do with those in green, those in yellow, those in red. What are the next steps? Where are we going to put them? But we may be able to bypass some of those and really get to the mental health issue and go, no, I think we would waste our time if we put them in that program, because here's what the targeted screener says. So I think it would be great for us to be involved in that. I think it's also important, let's say the district is looking at evidence-based social emotional learning programs for Tier 1. They want to start implementing those. We should be familiar with those. mindfulness programs that all the teachers can do. They're very easy. There's scripted ones are out there. There's really no training that you need, very little. Then, of course, restorative practices. We should be familiar with all of that, and certainly be trained in supporting everybody. And here's just a quick example of what we did in one school. The special ed supervisors really wanted to raise the bar on their emotional support classes. So they created a team of all the emotional support teachers and the supervisors, as well as other individuals and the community agency. And we all suggested, we all knew different programs, and we had about 4 or 5, maybe even 6 programs that we were looking at. And we actually used the NERN tool, called the Hexagon tool from Implementation Science. And it's a really nice, systematic way of researching social emotional programs and going through and rating the different categories of what it takes to be ready to implement, training costs, sustainability, outcomes, and quality improvement. And each person took one program, and then we researched it. And when we were ready, we came back, we presented it to everybody. And of course, you wanted yours to be the best. But what was really nice is that everybody sort of gravitated to one because it was just part of their style and their personality. And it wasn't one that I researched, it was one they researched. So the ownership is really important. They were deciding. We were a part of their team. We offered suggestions, we researched ours, but in the end, they decided what was going to be best for them. And then I think the third category here that you see on this survey is identifying external resources, resource mapping. So let's go to the next slide. Thank you, Scott.
You're welcome, Deanna. This is excellent. Hey, this is excellent information. Excellent information.
When we started resource mapping in the beginning, here's what we had. We had the psychiatrist in the community. We had psychologists who do therapy, and then we had other clinicians and licensed therapists. We maybe had the YMCA and a few community links, but it was very little. By the time we got done, and remember, this would be for tier 1, because that's what the survey was saying, we had categorized everything down to the minutia. We were so granular, and I loved it because we categorized things. And of course, it was a very thick packet at the end, but this was something that the school resource officers or the school home visitor could use. This was something administrators, school counselors, teachers. So we were able to sort of empower them to do their jobs in a more specific way. And what we started to do was we fine-tuned it. We had lists of specialized therapists. So those who did trauma interventions like EMDR, eating disorders, who was specializing in eating disorders, specialized hospitalizations, whether they were psychiatric or drug and alcohol, or hospitals for mental health, eating disorders. We had food banks, we had summer programs, we had lots of resiliency building programs, such as the medical centers in the community, where we'd hook up students to be mentored or be candy stripers, per se. So we were looking for not just therapists and hospitals, but we were looking for very positive places that families could become a part of that didn't really cost any money. And I think this, not only did we do that, but we started building relationships, especially with the EMDR therapists, because we weren't doing EMDR or dialectical behavior therapy at the time. We were going to be trained later. So I had this little hotline calling them saying, hey, I hear you do this. I want to connect with you. We have a huge need here. And of course, they were all full and had waiting lists. So I just kind of kept calling and asking for support. And I knew which psychiatrist to go to and which were the really good ones, because I didn't want our students, no matter what their insurance was, to only have this psychiatrist. I wanted them to have access to the best psychiatrist in the area. The other pieces, so that's the resource mapping, and other ways we could be working on Tier 1 is we were available for faculty. This just sort of happened intuitively as we built trust and got to know teachers and school counselors. When they were struggling, they would come in, knock on the door, and we'd just sort of sit down and start talking and processing things. And people would ask for recommendations for therapists, for friends of theirs, for themselves. And it was really nice because we often focus on the students, but our staff, they are going through tremendous times, as you all know, and we are one way that we can help support our faculty, just being available for them. I think sometimes being available for them help them become less burned out, be less compassion fatigued, and providing them with skills so that they would be able to teach the way they wanted to teach. Becoming a part of the crisis team, Tier 1, another intervention. As I talked about earlier, check-ins. I'm checking in with teachers. I'm checking in with guidance, administrators, attending the faculty meetings only if that's outlined in the contract. Some are okay with that, some are not. And then critical to meeting legislative needs, and Scott's going to talk about this a little bit later, our agencies can really support you in meeting these new legislative requirements, Act 18, Act 44, and Act 71. So that's kind of an overall generalizations with some specifics, some general ideas of how you can look to incorporate community agencies in your Tier 1 supports.
That's an excellent point, Deanna. Some of the things that I think about is over the years in education, I could remember when I was a school psychologist in a school district, and oftentimes the superintendent would say to us, hey, we have a lot of kids in out-of-district placements. And I'll say, well, those out-of-district placement at this particular time, based upon the supports that we have in our school, we're not able to meet those needs. So that outside agency then became our continuum of service to make sure we were meeting those students' needs that had those special mental health needs that we often work with in a school setting. Then we started to partner with community mental health providers and agencies. And it took a long time. I remember in one district, it took us 4 or 5 years before we felt we had enough multi-layers of support in place that we wouldn't have to perhaps then send one of our students to an outside placement. Because really we wanted to keep them in-house. The parents wanted them to be in-house. Then when I went and I worked for an intermediate unit for a number of years, then I really saw when we started to implement PBIS in our community-based schools, where we were working with students from other school districts, we had the layers of support that you just spoke of. We had the psychiatrist that we could contact. We would meet with weekly. One of the sites we would meet with them monthly. We had mental health providers because, again, as an intermediate unit and school personnel, we had really good social workers, school psychologists, also guidance counselors, but we all had our niche. We all had our level of expertise, and a lot of us weren't comfortable in providing trauma-informed care. And if a student was sexually abused, we didn't feel we had that insight and we didn't have that knowledge. So again, we were able to kind of tap into those resources. And those folks were able to come into the school at certain times and provide that support, especially when we had a parent that really they didn't have transportation to get the kids to an outside therapy session. So it was definitely, I think, a way. And a lot of the districts, I think when I meet with district representative across Pennsylvania, some districts still, have to send kids out to be able to meet their needs. Some have started to incorporate more mental health providers in aiding them in their support to kind of increase their level of supports. And what's really neat is I started to see within about the last 5 years is the integration into that MTSS framework that we spoke about. And all of the things I think that you spoke about this morning so far is really beneficial for a district's comfort level too. that, hey, there are additional resources out there. We're working as a team to provide the best supports for the students that we service. And sometimes we have to kind of think out of the box a little bit and try different things. So I just wanted to kind of add that. And then we'll talk a little bit about supporting mental health in more targeted selections on our next slide in tiers 2 and tiers 3.
Scott, I think those are all great points. And we really worked through, it was actually a grant that PDE had put out to decrease out-of-district placements. And this is when we really had to raise our bar, because the community therapists, they were overwhelmed. And so I would call them and they're like, Deanna, I would love to take that student, but I can't. So we said, all right, we need to be trained in this. We need to spend the money, however everybody sees fit within the contract, and let's provide it in this school. And so we actually did more on tier 3 at the beginning, but we backed up to tier 2 because we wanted a two-pronged approach for the out-of-district placements. So we need to start intervening earlier with groups and targeted screeners, so we knew exactly which groups to put students in. And then, so that would prevent them from going to out-of-district placements. And if they weren't really responding to the groups, we'd move to the individual therapy, the family checkup programs, which you're seeing on this slide, which would be more tier 3. And so we would support them and prevent them from going. But we also would work, and this was the second prong, we would work with the IUs or the hospitals and make sure that we knew when they were coming back. And some of them were very stable, they were doing well, and the school didn't think they needed extra support, but some were coming back and they said, no, we really think they need to go into other services within the school. So they didn't just come back, melt down again, and the recidivism rates increased. So there was a lot of stuff that we could do to prevent and also support as they came back.
Excellent.
This next slide, so that was a little bit about tier 2 and tier 3. I think most people know what we're doing on tiers 2 and 3. This is really something that is individualized with every district. It would be very helpful as a community agency to have some access to the data that the school has collected. Doesn't mean you have to provide all this data. And we know that the PAYS survey likes to be kept confidential. So maybe with the school climate, maybe you just give us a little snapshots of the school district climate. Maybe you give us the SAP number of referrals. So we go, oh, that's going to be a data point. Let's decrease those referrals. Maybe you don't provide us with the whole PACE survey, but we talk about some of the data points about suicidal ideation, about resiliency and risk factors, and how we can help in mental health areas, questions that are on the survey. You've certainly got all the PBIS data, universal screening data, if you use that, academic and behavior progress monitoring data, early warning systems. If you want us to work on attendance and building graduation levels, we definitely need to be able to see attendance data and behavior data, course performance. And I would check, we had a lot of students with major attendance difficulties, and I would come in, and this is where the computer access to a student's attendance is important. Were they in school? Were they not? If they're not in school, I'm on the phone. I'm driving out to the home to do a home visit. What's happening? Are they having a panic attack? Do I need to work them through that? Is it something else? So all of these, and then we talked a little bit already of out-of-district placements. So all of these data sources, and some that Scott are going to share with you on the next slide, I think are critical to give the community agency an idea of what is happening. Let me add, just because I'm always got my clinician hat on, there's something called the Student Refusal Assessment Scale that we would use. And there are functions, we all know there are functions to behaviors, and there are 4 functions that this scale looks at. So I would always use that, because how do you build an action plan? And I would go before judges and was part of all the attendance pieces that you talked about. And I would always recommend that the scale be done so we can figure out, is there a mental health piece here? Is this just a behavior learned piece? What is there a medical piece? What are we missing here? So it's a really great scale that helped us a lot along the way, because once we pinpointed it, it was much easier to come up with an action plan.
Oh, that's great information. Outstanding. This is pretty special behavioral bite there, I think, Deanna. We want to thank you for your expertise for sure. Okay. And then also some of the things that we think about when we think and look at data is really as a school or as a district or as a community agency, the number of community resources being actively used is also important. We also take a look at what's called our CEDAR data, which is special education data reporting. We take a look at evaluation data, 504s, prevalence rate, state averages for students that have that are in particular disability categories, as well as our special education outcome and our graduation data. Also, another things that we look at when we help justify certain types of services and to pinpoint correct interventions for students is we do look at a lot of equity data, disproportionality data, and essentially we also spend a lot of time on school safety and school assessment. Now, naturally, we've provided on the last two slides a lot of information and a lot of data sources. However, I think what we do is we always want to remember that we're going to choose maybe 3 or 4 of those to help capture kind of what our overreaching goals would be then for our school building, for our district, for our intermediate unit run programs. And again, in all cases, we know that data is confidential. So, but we have to be, I think, willing as a school, and I have as a school administrator and a school psychologist, shared particular types of information with our community-based partners with parent or student permission, because it really helped us kind of move our buildings further educationally as a whole, and then also improved our intervention rates and our graduation rates with our students. There's another good resources that you see on the slide. And essentially it's SAMHSA, Substance Abuse and Mental Health Services Administration. It's using data to improve student mental health needs. So it also allows you to look at the different types of data and how to use it for what you're trying to accomplish as you establish your goals. So that's also something that's very helpful. It kind of gives you a good starting point. So if we were to think about then, Deanna, what are some of the major benefits or the favorite takeaways that we would have as a result of creating these school and community-based mental health partnerships? What are some of the things that might come to mind?
The first thing that comes to mind is saving lives, and saving lives. I don't think that we therapists in my community agencies save these lives, but we could document working with the school, the counselors, the administrators, the family, when we were all working together. And we had a lot of youth who were having suicidal thoughts and ideations. Some had very clear plans, some had not so clear plans, but we were catching kids right and left because there was such great communication between everybody. And there's not a doubt in my mind that people's lives were changed. And I think that the trajectory, so if it wasn't just saving lives, which I think the powers that be is really, we're just someone who kind of has been brought to intervene.
Sure.
Changing the trajectory of a youth and family's life from going down this path and then helping them change the trajectory to go down a more resilient, positive path. And as I said, the closer the partnerships with the school district and with the therapist, the more success we had. If there was less communication and integration, we had less success. And also taking the stress off of school staff. As I talked about staff coming in to talk to us, I think that's huge. And checking in with them. So they may come down to our office, or I might be doing some conflict resolution with a teacher and a student, because many of them were open to that, or us providing consultation in their classroom. But after the student left, I would just sort of check in with the teacher, how are you doing and what's going on in your life? And you start building these relationships. And I think our job is to really help take the stress off the school. Everybody is overwhelmed. So our job is not to replace anyone, it's to fill the gaps. And I think that's a huge gap, is helping support school staff and guiding them to resources. Let's see, what else? Teachers at times will give up making referrals because nothing happens. They don't trust the services, but once you have those services in place, you go, oh, wait, now we actually do. Once they go through SAP, they're going to get some sort of service. It might not be in school, it might be a community resource, and we can circle back to the staff and help them understand what the process was. We can't always tell them exactly what, and you have to be careful because the person who made the SAP referral, it's confidential. But if they ask, why was this student not helped in this way and that way, you can answer that in as briefly a way and correct, confidential manner as possible. And I think one of the huge things is teachers start teaching education and concepts in their classrooms. We're teaching skills, and the youth aren't always making tremendous progress, and the school might feel like it's just not working. And what I have found, because I've been doing this for many years, there's some students who have contacted me in later years saying, Mrs. Moore, I didn't quite, or I wasn't mature enough to use that skill at the time, but I'm using it now and it's really helping. And I think about the things you taught us and my colleagues, it's not just me, I had incredible colleagues, what they taught them. And so I think it's important to remember we're planting seeds, and it's not for nothing that we're doing all this work. It really does pay off. It just may not pay off right away. And parents being thankful for the services, I think that's a huge takeaway. Parents can often have a very controversial, negative relationship with the school because they feel like the school should be doing everything, where we start to build relationships with the family and say, hey, what are you doing? How can you help? And let's get you some community resources so that you can step up to the plate rather than expecting the school to handle it. So I think creating positive relationships with parents and school districts was a huge outcome. And creating lasting community connections. I talked about a little bit earlier. We really, through the resource mapping, identified certain agencies, hospitals, businesses that we partnered with. Creating the resource list that we talked about was a really empowerment for faculty and family to really understand what's out there. And then I think supporting the legislation. We are there, the schools now have huge obligations to meet certain acts, and I think we can be part of those plans, which I know you're going to share.
That was excellent. Another question I'm often asked by administrators is, what about the legislation related to school mental health services and the school district's obligation to implement such services in the school setting? And I think of when you and I had our preliminary conversation in the context of this behavior bite, kind of when reviewing the laws governing this topic, it's often advantageous really for school-based mental health providers and educators to partner in supporting students with mental health needs for the various reasons that you talked about before, but especially not a lot of the participants that we'll have reviewing this behavior bite are going to be familiar, if they're working in the school setting with Act 18, Act 44, and Act 71. And it really is important to be able to make sure that we're meeting the requirements and then exceeding the requirements and taking the school that you're in or the district that you're in to the next level and supporting students. Because those students, when they graduate, and I know when I think back, I just thought of this now in my career, for about 20 years, I worked with a psychology firm in private practice. And then essentially what we did was When students are in high school and they have an IEP, the Office of Vocational Rehabilitation gets involved with those students and they provide supports. One of those supports is they often have the students evaluated by an outside agency to kind of see what kind of services those students will need when they go to adulthood in the adult agency setting. And it's interesting to me, over those 20 years, listening and doing those clinical interviews that took an hour and a half at times. And I could, unfortunately see the younger students that are now either younger adults or older adults, the types of supports of services that were in place for them while they were in school was really, like you said, it changed their trajectory. No matter what their health needs were, the mental health needs, if we give that as an example, those students were able to kind of have more supportive supports in place, and they were able to kind of find themselves in really good positions for employment. Some of the students that might have not had those types of services, it definitely impacted that trajectory. And it was kind of sad to see, and especially knowing, what District A has compared to District B. But one of the nice things I think about this Behavioral Bytes, it shows that by accessing our school mental health providers, community-based agencies, we can link to them as a part of that multi-layers of support that we need for our students before they graduate. And that's critical. So I just wanted to kind of share that. Okay. Now, another question I get a lot is, and I'll let you chime in on this one too as well, but really it's in regard to implementing trauma-informed care principles and mental health literacy practices into the school setting. And here, building level administrators, directors of pupil services often inquire and they ask me the question, like, we want to do this, but we really don't know where to begin. And we know this is critically important work. We don't feel like we're the experts in this area. And I often have to say, I'm probably not the expert in this area here either, but we do kind of have at least a roadmap that I think that we can all feel comfortable with. Whether you're a seasoned administrator, a new administrator in a building, or a school district at your pupil services department that you want to move the district forward. Oftentimes what I'll do is I'll reach out to Deanna, or I'll reach out to Dana Malakovic, who is our mental health and wellness and trauma specialist through the Office of Safe Schools at the Pennsylvania Department of Education. And often she partners with us at Patton. And she gave us some really good information to be used when we think about getting started with trauma-informed care. Now, one of the things that she suggests for district personnel especially, or for folks in intermediate unit programs, although intermediate unit personnel were very knowledgeable, the school social workers, school psychologists, the school guidance counselors, was really to review first maybe the model of trauma-informed plan, and then connect the school district with what's called the SEW, or the social emotional wellness lead at the intermediate unit. Each of our intermediate units across the state has somebody assigned as this lead. So that's a person that's trained in trauma-informed care, as well as so are the outside mental health providers that we've been speaking about today as well. Then typically you start to work through the SHAPE assessment. There's two versions. You would look at the school, you would look at the district assessment, and then start to think about and develop a realistic look at where they are or where you are in the readiness for being a trauma-informed system. And then to develop some sort of an action plan that's going to really align with the work that you're already doing, okay? Ultimately, when we think of this, we think it's not about starting something new, but looking at some of the supports and services you already have in place as a district, aligning that work that you are doing and being more intentional about the work that is being done. And then if a district needs more training, there's also some trauma-informed care practices modules that's been created, and they're housed in the Pennsylvania Department of Education's Standard Aligned Systems portal. Those could be beneficial for individual teachers as well. And remember, when we think of this, you still want to capitalize on the services that you're already providing, as I said, and you want to integrate the trauma-informed care principles and mental health practices procedures into your MTSS framework, really at the tier 1 level, because that's where all this really starts. But Deanna, before I go on, do you have any other kind of comments about this particular section?
And in general, I just want to make sure that Yes, there is NERN, there's the shape system, but none of these, I like what you said, none of these should be superseding your PBIS, your MTSS, your ISF frameworks. You can incorporate it in there. So I don't want people to think, oh, instead of doing PBIS, we do shape. So it's just an incorporation and integration.
Yeah, great point. And also, as I had indicated, then when we think about comprehensive mental health training for Pennsylvania educators, this is what I spoke of on the last slide when I started to talk about the standard aligned systems porthole and information in there on trauma-informed care. And there's actually modules that are set up where educators can explore mental health literacy really in the context of the initiatives such as the Pennsylvania Career Readiness Skills. It also ties in equitable practices, trauma-informed teaching, accelerated learning. And really, this foundations can help teachers to develop positive, safe learning environments for themselves as well as their students. And as you can see on the slide, some of the actual learning outcomes would be, if a teacher would participate in these modules, is really you're going to be able to describe how mental health literacy knowledge can improve your classroom environment. You'll be able to identify some key components of a safe, supportive learning environment. And as you see the third one there, how to evaluate how you will integrate some of these Pennsylvania prioritized initiatives into your daily practice. So really, in relation to this behavioral bite, as we said, school-based mental health providers can help with Tier 1 follow-up from trauma-informed care, as well as mental health trainings that help support the school staff and take the concept and information in the modules and provide further examples of how to apply the learned knowledge in the classroom setting. And I think that's the key to all of this is oftentimes we have lots of good information, but really it's important to integrate it into the classroom setting so the students kind of has access to that knowledge and that information. Anything else before we move on, Deanna, about this part?
No, that was perfect.
Okay. All right. Well, I think it was some really great information, Deanna, that you shared with us, and I enjoyed partnering with you on this project.
Likewise.
We want to thank you very much for being our partner for a number of years through a lot of our initiatives through the Pennsylvania Department of Education and Patent, and your expertise has been invaluable to us, and we appreciate that. But we also want to thank you for joining us today as we shared our tips for school-based mental health providers and educators partnering to support students with mental health needs in the school environment. As always, we want to make sure that as PDE's commitment to a least restrictive environment, our goal for each child is to ensure individualized education program teams begin with the general education setting with the use of supplemental aids and services before considering a more restrictive environment. And that's kind of the goal. Really, we know that students do better when they can stay in their own districts. Not that there isn't a lot of excellent programs outside of our school systems, and we do use those schools as our continuum of service. But again, most parents that you talk to would like their children to be educated in their home schools. We know that too. And then, oops, I think I buzzed through here a little bit quickly. Also, our mission statement. You can see our mission statement from Patent. The mission of our Patent agency is to support the efforts and the initiatives of the Bureau of Special Education and to build the capacity for local education agencies to serve students who receive special education services. And remember, this is just a bite of behavior, so we'll see you next time.